Hey guys, Doc Heps here with UroCoach. So are things moving a little too fast for you? We're going to talk about premature ejaculation, so stay tuned. Hi guys, Doc Heps here with UroCoach. So we're going to talk about premature ejaculation, a little bit about what it is, how it affects men, and certain treatment options. So I appreciate your time and thanks for watching. Premature ejaculation. It's a very, very common problem. Lots of men have an issue at some point in their lives, and to be honest with you, nobody really knows why it exactly occurs. But again, the first step is to recognize that many men go through this, and it's very common. For some, it's not an issue, but for other men, it can be problematic. It can affect their intimacy, it can affect their relationship, it can cause certain mood problems. Men can get depressed because of it, and it can affect your confidence and overall affect your quality of life in a negative way. So it's something that should be recognized, and there are potential treatment options that may help that component of your life. What is premature ejaculation? So there's no standard reference where it qualifies that if sex is under a certain amount of time, that is considered premature ejaculation. Alternatively, there's no sort of gold standard length of sexual activity where folks say, hey, this is adequate. It's variable. It is variable amongst women and men. So there have been questionnaires that have been put out in both women and men generally have expectations that are a lot longer than women. So on average, some of the questionnaires have noted as 7 minutes as an average time for sexual activity. Again, for females, optimal sexual activity, it would range more in the 10 to 20 minute range, whereas for men, it was over 20 minutes. So talking about it with your partner and understanding what's normal and not normal can help a lot of couples to better understand what's appropriate and normal for them. We don't really understand why this occurs, but we do have some options for treatment. And sometimes this ranges from just talking with a counselor, going over certain things with and relationship issues with a psychologist. And there are many psychologists out there who may be helpful in just talking through these issues individually and as a couple. More medical options include over-the-counter creams that have a numbing effect. So the problem with these creams is sometimes they can be transferred to your partner, which is not desirable. But there are over-the-counter creams that have a numbing effect, and it depresses the sensation and hopefully will prolong the erection and delay the ejaculation. There's other techniques called the squeeze technique, where if possible, before you achieve orgasm or ejaculation, you stop activity and you squeeze the penis fairly significantly, pretty hard, and then you repeatedly do this until you build more durability and time. And that maneuver, along with numbing creams, has been shown to help delay orgasm and help with premature ejaculation. And then there are a few medications that we use in some men that can help. It's Viagra, Cialis, called phosphodiesterase inhibitors. They're not really designed to delay orgasm, but they may help you achieve erection more quickly after an orgasm happens. So that sort of decreases what we call as urologists the refractory period, the time between orgasm and achieving another erection. And that's pretty much how Cialis and Viagra come into play. And for some men, those medicines work great. Other medicines like SSRIs, something like Prozac or Paxil, have been used to help depress the orgasm or delay the orgasm. These are medicines that have typically been used as antidepressants, and their side effect has been known to cause delayed orgasm. So we use this medicine not for the antidepressant effect, but for the side effect of it that causes delayed orgasm. And so some men use this on a daily basis in a low dose form, and they have a lot of success with their improving their sexual function. Lastly, there is an opiate or a synthetic opiate called tramadol that's been shown to help improve or delay orgasm and improve premature ejaculation. We tend not to use it because it's an opiate, but just so you know, it's out there and may be appropriate for the right person, although I tend not to use this. To summarize, premature ejaculation is very common. There are treatment options. They can range from over-the-counter creams, some general behavioral adjustments, talking to a counselor, to medications. It's worthwhile investigating and talking to your doc or urologist about it. Again, it's very common. You shouldn't be bashful about it. It can affect your quality of life, your mood, your relationships. So it's worthwhile investigating. So thanks for watching. Check out our other videos. I appreciate your time.